Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome back to another episode. Today I'm with Dr. Hunter Dawson. He is an oral and maxillofacial surgeon practicing in Charlotte, North Carolina. Dawson, thank you for joining us on the podcast, or Hunter.
Thanks. Yeah, thanks for having me, Grant. And I appreciate the additional credentials, but I'll stay just a prosthodontist for now.
Sorry, yes. That's what I meant to say, prosthodontist.
Thank you.
Yeah, well, good. So we've wanted to reconnect and just do an episode kind of on that aspect of growing your implant practice. I know you have tons of experience with this, you lecture on it, but yeah, where would you start? You know, if you were being consulted by an oral surgeon who had that question of how do I grow my implant practice, how would you start it off?
Yeah, I mean, I think anytime you're looking to grow your implant practice, or if I was being consulted to, to give advice on that, I think the first question is going to be, where are you now, and where are your limitations, or what do you think your limitations are? Growing an implant practice has different pillars that you really have to focus on. And if you're right out of residency, those pillars that you need to focus on may be very different than if you're 10 years out. So the first question is going to be, where do you think your strengths and weaknesses are in your implant practice? So I think knowing what those are from the surgeon's perspective are super important. So for example, a resident right out of school very likely is going to be their competency with placing implants, just their experience actually doing the procedure.
Yeah. Okay.
Yeah.
For someone who's a few years out, maybe owns their own practice or is an associated part of their practice, feels pretty comfortable with the procedure itself. Maybe they're kind of not as comfortable talking to patients about cases. Maybe the pros aspect is still a little bit of a mystery. Where would you go with that?
Yeah, I think that's the natural next step to become a really proficient implant surgeon, is to become well versed and knowledgeable in the restorative components of the procedure. That's what's going to make you a great surgeon. So the national average, if you were to look at all the oral surgeons in the country, are placing somewhere around 150 implants a year. And you might say, wow, that's a really low number. You would think an oral surgeon places a lot more than that. But most oral surgeons practice a mix of those core procedures, right? As I'm sure you do, right? You take out wisdom teeth, you do regular extractions, you place implants. And so they're not just placing implants all day. But then you have some really elite practices, like some of the practices I lecture for, that place 1,000, 1,500, 2,000 implants a year. And so if that's the type of practice that you're chasing, not only do you have to be a very talented surgeon, but you have to be knowledgeable on why you're performing the surgery, which is to be restored. That's the entire point of the implant, is to restore it with a prosthetic, with a crown, with a overdenture, with a bridge. So you really have to take CE and educate yourself in those aspects of the treatment.
Got it. Okay. So CE can help. I mean, what other ways do you coach, surgeons who probably are not? I know some are in a specialty group practice where the prosthodontist is there, but if you're not in the same practice, is just shadowing going, helping? I mean, what are the things you really recommend?
Yeah, I mean, I think one is going to be, partner up with, even if you don't have a prosthodontist, or it could just be a really talented restorative doctor in your community, partner up with them and use them as a mentor to you on that side of the treatment. Follow your cases. If I was saying, hey, how do you become better, right? Is follow the case to the end, right? See the patient back after the implant's been restored. Self-critique not only the implant placement, but self-critique the soft tissue, self-critique the prosthetic, whether it's a crown or a bridge or an overdenture, what went well and what didn't, and how did you contribute to that success? Because we're talking about a lot of the technical aspects of the treatment of growing an implant practice, but really that's one pillar.
Mhm.
Execution of the treatment is only one pillar of growing an implant practice. As a surgeon, you hope that that's a pillar you're really good at, right? The technical aspect of it. But there are other pillars that you have to focus on. So I would definitely encourage you to follow every implant to completion, especially early in your career. See those implants back for evaluation after they've been restored as a learning tool, right? How could you have done it better, to make it easier on the lab, easier on the restorative doctor, and a better outcome for the patient ultimately. So those are things that you really can focus on the technical aspect of treatment.
Okay. What are some of the other pillars that you potentially could coach someone on?
Yeah, I mean, I think a huge one is communication, and there's a lapse in what we think is good communication and what actually is good communication. I see practices where normal communication is an email after treatment is completed. I see practices where a letter being mailed out after treatment is completed is normal. The extremely high volume placers that you see out there that are placing 1,000, 1,500 implants a year, they're engaging the patient and the referral process so early in the process, in the treatment, that the communication starts before treatment ever begins. And so I think that's a big takeaway is, how are you communicating and what systems are you putting in place, not only from doctor to doctor, but staff to doctor, staff to patient, and what's that workflow? Typically, that's the biggest area of improvement that a practice can have is lapses in communication. And the problem that really exists with communication is this is a team treatment, especially in a referral network. As an oral surgeon like yourself, you are dependent on the outcome and someone else carrying the baton for the second half of the treatment. So communication is so critical, for the outcome to be excellent versus average, and that's ultimately what you're trying to get practices to refer to you for, is the outcome that you're providing for them. I think a lot of oral surgery practices may lose sight of the fact that the revenue isn't the patient solely, that the customer is also the referral, right?
Yeah. I mean, what have you seen as some of the most effective things that's done prior to treatment beginning that really improves the communication?
Yeah, I mean, some of the great surgeons that I've worked with, and I'll give credit also to not only oral surgeons but great periodontists that place a lot of implants that I've worked with. Um, they will engage me as a referral before they see the consult, right? So if I referred you a patient, Grant, and you see that patient coming up on your schedule at 11 a.m., I'm getting a phone call the afternoon before saying, "Hey, tell me about Miss Jones." Right? What am I walking in as an oral surgeon? What am I walking into this room to talk about? And what do I need to know about Miss Jones? I think that really closes the loop for the patient. I think oral surgeons that do that see their case acceptance rates go through the roof, because they're walking in educated, not going, "Well, I didn't get the referral. I haven't talked to Dr. So and so yet. I don't know what's going on." That carries a lot of confidence into the room. And so for surgeons that are trying to build their referral network and ultimately build their practice, walking into the room with a referred patient with the confidence of, "Hey, this is what's going on. I've already talked to your doctor. You're a great candidate for this procedure. What questions do you have for me as the surgeon?" is a very different conversation than going in blind.
Oh, for sure. So helpful, even as the surgeon, to get the the lowdown from you, to know what some of the finer points of the treatment are, potential complications. Walk into a patient room and talk about that fluidly, I think would be very comforting to a patient, very impressive.
Now, I don't want to only single out the surgeons and make it feel like it's a 100% their responsibility that communication is thorough and fluid, because there is a big lapse with the restorative referrals nationally, from what I've seen, where you might get a referral from an office that says, "Please evaluate for implants." That's all it says. It doesn't say why, what tooth, what the goals of treatment are. So another big thing that a practice can do is to pick a smaller cohort of referrals to raise their communication, into the practice, into the oral surgery practice. How are you going to raise the communication so that when you get referrals, it's not this fact-finding mission every single time before you walk into the consult? And I think that's a big thing you can do to elevate your referral network as well.
So what would that look like? I mean, you're training them, you're talking to them, kind of saying, hey, here's what's helpful, or what do you recommend?
Yeah, I mean, everybody has a different flavor, right? In terms of how they want to educate their referrals. I think the biggest thing is a relationship-based education. So whether that's you sitting down with a small group of referrals and educating them on what's helpful when they're referring patients, or if that's you doing small education events to help with that communication. But at the end of the day, it falls on what you need as an oral surgeon in your practice to be communicated, how you want it communicated, what's helpful, what's not. And a lot of times that's reviewing previous cases that have been referred. So let's say you've got your top 10 referrals, and your top 10 referrals, you're struggling with case acceptance or identifying the right candidates for treatment. Or maybe they're just not giving you enough information, and your treatment coordinators, implant coordinators are having to call and dig for information every time. That's not a good use of time. So how do you fix that? You take that small cohort and you elevate their level of communication. And I think that takes a hands-on approach. I think that's where a lot of surgeons that I see that are trying to grow an implant practice, the perception is you can just go engage that practice, drop off referral pads, and that's going to increase the quality of the referral or the number of referrals. But it really takes engaging those doctors to help elevate their knowledge level and what they're communicating to you.
Got it. So a little more than just dropping off a referral note. It's relationships, running through things, maybe explaining all the benefits of more detailed communication, all that type of stuff.
Yeah, I mean, when you're thinking about those pillars, communication has so many different levels, right? We're mainly focused about doctor to doctor or the referral, but how's your front desk filtering that referral from the referral's office? How's your implant coordinator engaging, and when are they engaging that referred patient? What's your assistant saying in the room when they're seating them and going over the practice information? And then how's the treatment plan being presented to the patient and back to the referral? I mean, communication is very, very multifaceted in an oral surgery practice. And in many practices now, that falls on the doctor. A lot of times we think we can, delegate that to the office manager or delegate that to someone in the practice that's going to set that tone. But really, in your practice, I'm sure, right, the tone is set by what your expectations are as the surgeon.
For sure. What are some of the other pillars of, I don't know, how growing a successful implant practice?
Yeah, so we talked about the technical aspect, right? That's actually doing the procedure. Communication is a big one when it's relating to how you're communicating with referrals, but also one thing we haven't gotten into is how is your practice communicating with patients? So you've got communicating with the referral, which is, in my opinion, a consumer, right? That like the referral is buying the product that you're selling of your practice. And then also the patient is coming in to invest money in your practice or spend money in your practice on the treatment. And so how you communicate with patients is a huge thing as well. You might have a great referral network and a terrible case acceptance because either you, the doctor, aren't well versed in how to communicate to patients. It could be your implant coordinator. I mean, out of curiosity, Grant, do you present treatment, or do you have a coordinator that presents treatment in your practice?
I present it. Yeah.
And is that your own, like you feel like you need to, or is it you're worried that they won't present it well, or the way you want them to? Like, why do you hold on to that?
That's a good question. It's probably all of the above, maybe there's some of all those facets in there. Probably just feel like most patients want to hear it from the doctor. We've tried having, it'd be solely like a non-doctor person do that. And oftentimes it's like, well, I understand, but could the doctor tell me? I don't know. So usually we just end up going back to me kind of running through things. But what do you think about it? What do you do?
Yeah, so I mean, I review, for me personally, I review the treatment proposal to the patient, but it's a verbal conversation, and then
Right.
once the patient is like, yeah, that's what I want to do, that sounds great. Typically, my coordinator is then going to review, what's the next appointment, what's the treatment cost, financing if needed, and so uh, I kind of step out of the way once it gets into a logistical conversation, and
Okay.
I think that's strategic, right? I think practices that want to see a lot of consults, which the reality is most of us do see a lot of consults. You need to be able to delegate some of that, but it is hard to let go of, right? Because, oh, what if they say it wrong and it scares the patient? Or what if the communication isn't how I would have done it? And the patient walks away or goes to another practice or is even put off by the way it's
Yeah.
presented. So there is a lot of value in how you communicate to the patient as well. So, again, pillars of success, technical, right? Communication, which is kind of two pillars, because, and I think that's one that I can't overemphasize it enough, is that communication is two pillars, right? It's referral and patient, because both are a consumer to the product that you're trying to sell, which is the
Right.
services that you practice. And ultimately, that's going to be what helps grow your practice, right? Do people want to continue to invest in you as a practice and as a surgeon? And then, at the end of the day, what are your patient outcomes saying, right? Like, you do the procedure well, you communicate well, you can communicate well with patients, you have good case acceptance, but then what are the results at the end? You can place a lot of implants and not be a good patient outcome surgeon, and I think that's something you have to be careful of. Um, Patients see through that. Referrals see through that. At the end of the day, is the implant system that you're using going to be something that's easy for the patients and for the referrals? All of these little things that come into play. We can get into, the little nuances of all these pillars, but those are the overarching themes that will help grow an implant practice.
Okay. I mean, one other question too is just on the diagnosis end of things, as the specialist who usually gets a referral, we kind of assume like there's been a diagnosis, it's all all of the end game has been explained, but like you're saying, so many referrals will show up and it's just evaluate for implants and we're like, what does that mean? And we're trying to basically diagnose ourselves and so sometimes even the inexperienced dentists don't know. I mean, they don't know where to go with the case, and they're asking me, what the whole route should be. How do you coach someone on that to kind of refine that process?
Yeah, I think I certainly don't envy oral surgeons for this, because I feel like you unfairly have to wear two hats in these situations. It would be nice as an oral surgeon, I would imagine, if you just had to focus on, can the patient have surgery and can I do it? And like you said, I mean, I spoke with a very well-known surgeon recently, and they don't have a prosthodontist in their area, and so he has to wear that hat for a lot of cases. He has to decide if they're going to do it this way, how many implants they're going to place, how's it going to be restored, and then to some degree help coach the dentist in that process. And that is a tough situation to be in. I think that's why I said focusing on the education from a prosthetic standpoint for surgeons is so valuable. And I know we kind of get in a tunnel vision of like, I need to go take a bone grafting course. I need to go take a zygomatic implant course. I need to go take a remote anchorage course. But what if you went and took a diagnosis and treatment planning prosthetic course? Would that help you as a surgeon? And I would say tremendously, um, because y'all are really good at building the foundation, but you can only be good at building the foundation if you know what kind of house you're putting on it. Okay. And so that's what's going to be really important, especially depending on the community you're in, and being the leader, from a surgical perspective. What you don't want to get in a situation where you're the surgeon, you referred something, you don't have enough prosthetic knowledge to go, that's a bad idea. And you do the surgery, excellent surgery, prosthetically it was a bad idea and it results in a failure. And everyone's on the hook at that point. That's the downside is equally you could have an inexperienced surgeon, but you could also have an inexperienced restoring doctor that puts you in a bad situation as a young surgeon if you don't know what you don't know, right? So at the end of the day, you really have to elevate your education on, like you said, diagnosis and treatment planning, so that you can have those thoughtful conversations with the referrals and with your patients and say, that's a good idea, or that's not a good idea. Probably one of the single best things from a diagnosis and treatment planning standpoint I've seen for edentulous patients is for surgeons to know when a denture on the mandible is a bad idea. And so, in North Carolina, I trained in Kentucky, we saw a lot of patients that were edentulous on the mandible. And the question was, well, do you do an overdenture or do you do fixed or hybrid? And you need to be able to look at the mandible and go, that patient's going to be miserable with an overdenture, because they've got a lot of atrophy. They've got a high floor mouth. They have high muscle attachments. They have no frenum, or high frenum attachments, I should say. All of those things lead to like bad denture outcome. So you right away can look in the patient and go, I would love to do an overdenture for you, but you're going to waste your money because you're not going to be happy. Think about that from a revenue growth standpoint, right? But it's the right conversation and it's the right diagnosis. Okay. So like simple things like that as a surgeon, what if you knew that and could talk to your referrals and patients about that?
Yeah, that's a great point to be able to assess that. It's probably just as much to know what the best treatment is as it is to know what is the wrong treatment to avoid problems and, spending money and time that's unnecessary ends up being scrapped and redone.
Another big category that I would say that the elite implant surgeons really pay attention to is occlusion and alignment. So, you're an oral surgeon doing jaw surgery, you really pay attention to those things. I've seen that sometimes when it comes to single dental implants, we kind of turn off that brain and go, oh, it's just a single implant, right? The really elite surgeons will look at a case, even if it's a single implant, first molar, and go, Miss Jones, I'm sorry, I really think you should do ortho before we place this implant, right? Like, I really think your outcome is going to be improved drastically if orthodontic treatment is included in your overall treatment plan. And the surgeon having the knowledge to go, hey, let's hit pause. Let's delay the implant placement. Let me talk to the referring doctor and make sure everybody's on the same page. Like, that's a very knowledgeable and thoughtful surgeon that hits the brakes on a case to make sure the patient gets a better outcome.
Yeah, that's a really great point.
Have you run into that yourself?
Yes. Yeah. I was just going to say, just the other day, I had a patient referred, and it was just do implants 7 and 10, and they're missing 7 through 10. So 8 and 9 are gone as well. And they're just there for the implant placement. And I'm like, let's take a look before we do anything here. And, they bite down and it's like extreme deep bite, and their incisors are touching the palate. Like, I'm just like, what in the world, man? There's just no space, like I'm trying to explain. Patients just don't get it, and I'm like, in order to create the space with what we got here, we're gonna have to put these so deep. You're gonna have huge, long incisors. It's not gonna match your other teeth. And, I think, like you're saying, there's probably things we need to do to open up your bite. And it's, can be frustrating for a patient to walk in thinking they're getting implants and then like, wait, what? I don't have to do all this stuff. I mean, do you have experiences like that ever?
Yeah, I mean, weekly. I mean, one of the biggest things that I see are compensatory eruption situations, right? So compensatory eruption where opposing teeth move into the edentulous space for whatever reason. It could be wear, it could be malocclusion, it could be they broke or lost teeth. But when they're that compensatory erupted and the occlusion is a problem, it's never a simple fix, right? You can't just place an implant for the tooth that broke. And patients don't understand it because they're like, well, the tooth was there. But right. It isn't there and it broke because of basically engineering failure. And You have to explain that to the patients. But the bigger thing that I see, especially in the dental community, is I'm a 100% referral based practice. They refer those patients to me going, I don't know what to do, because I see the problem to some degree, but I don't know how to fix, like, I don't know how to get out of the problem. And a lot of times it's because the solution is a huge renovation, right? A huge reconstruction.
Yeah.
And a lot of moving parts, typically involving orthodontics, possibly more extractions, crowns on multiple teeth, and so forth. So, unfortunately, as an oral surgeon, if you're trying to grow your implant practice, you've got to be able to see those things and go, hey, this is a bigger case. And sometimes that means the referral you're working with, this is the hardest conversation, right? Sometimes that means the referral you're working with isn't the right doctor to help you with this case. And that's a super hard conversation.
Yeah, for sure. And patients too, like this patient I was dealing with, they're like, wait, are you just trying to sell me? I mean, this just went from a $4,000 case to like potentially 20 plus, and now I'm having to see it because I said you should probably see a prosthodontist. This is pretty complex, and probably gonna have to do some posterior crowns and things like that to open things up. And yeah, it is tough too because patients often don't get that. They think we're trying to sell them more work, and it's like this has nothing to do with getting more money out of you. This is like making sure my implants don't fail, and like within the first year. I mean, it just and so like trying to express that to a patient in a way that helps them understand. Sometimes I struggle with, and I've heard others do as well. I mean, any tips or tricks on that one you have to kind of really help and educate patients so it's less about money and more about this is what's actually best for you.
Yeah, I mean, one thing that's going to help is you being extremely knowledgeable so that the conversation sounds confident, right? Like, I'm not sure, I don't know. That's a big one. Another suggestion that I utilize every day, but I think that a lot of surgeons could benefit from, is having a lab partner that could quickly provide you with diagnostic wax ups digitally to show patients why what you're saying is true. So imagine that patient you described to me with the deep bite and your lab partner, if you had one, doing a digital wax up of the teeth that are missing in the correct spot where you would ideally want to place implants, and then how that collides with where their lower teeth are currently, and being able to show them visually. We're all visual, right? Like, I learn better with diagrams than reading text, I'm sure you do. And being a surgeon, you probably learn better actually doing it than looking at the diagram. If people can see what we're saying as opposed to us just telling them, most people then follow what we're teaching them. So I think a big tool that a surgeon can use is to have a really good lab partner that is good at helping with diagnostic wax ups to provide you with images as an educational tool for patients, to help them understand what their problems are. And that'll drive case acceptance. It'll also help communicate back to the referrals, right? Like, okay, there's another communication tool. Helps with the patient, helps with the referral. Better outcome for everybody. And is going to make your implants last longer, which is ultimately the end goal.
Yes, for sure. Love it. Yeah, that's a great tip. Any other, I mean, big pillars or things that you've noticed that can kind of boost your implant practice if someone's at a plateau and they kind of want to take the next step?
Yeah, I mean, again, it really depends on where your weaknesses are. But we talked about the technical aspect. We talked about communication, both with the patient and the referral. And then I really think the last one is going to be educating your team. Okay, so it's awesome that you're good at presenting cases. It's awesome that you're good at communicating with referrals, and maybe you text your referrals. Maybe you communicate really well that way. But what are you doing to raise the level, the IQ level of your entire team around you? The goal should be that your team is an extension of you, right? Like, I want my team to almost be a prosthodontist, but without the degree, right? And I mean all the way from the front desk to the office manager, to the coordinator, to the assistant. And so I think if surgeons take that mindset is, how can I make my team as knowledgeable as possible, as educated as possible? How do I teach them to talk like me, think like me, communicate like me? That will help elevate your practice, because they become an extension of you, not only to the patient, but when your number one referral office calls and they get the triage line in the back by accident, and your assistant answers and they realize it's your top referral, they immediately go into that mode of, okay, this is the top referral. What do I need to do to make this a good phone call? That's huge, right? And so that's getting into your team being at a high level across the board, from understanding implants, understanding communication, understanding the goals of the practice. But all of this really only matters if your goal is to be a very productive implant practice, right? If you're just going to be an insurance-based practice and take out teeth, this is probably a lot of overkill. So your goal has to be, I'm going to be a big-time implant practice in my community.
Does the education of your team, I mean, does that mostly happen just from you having educational meetings and teaching them what you know? Are you taking them to courses, or, I mean, how does it look?
I mean, yes, and yes, right? I think all of the above. Anytime you have an opportunity locally to take your team with you to a local CE event about anything that is going to benefit your practice, you should encourage your team, if not make it mandatory for them to attend. I'm a big believer in having team meetings that don't only go over metrics and problems in the practice, but are educational opportunities. So like, do you do huddles, Grant, in your practice?
Yes, for sure. Yeah.
And is it a daily huddle, or is it how do you structure that?
Yeah, it's usually an end of day huddle and a quick morning huddle to run through the schedule.
Yeah. So, that's pretty typical. And I think those are great. I think operationally they're very important, but also picking out a huddle during the week that is educational, right? Hey, let's review this case, but not just the treatment. How was the referral handled? How did Dr. Jones do in sending the referral? How did we do in communicating back to Dr. Jones? Did we hit all the pillars? And then, hey, Dr. Jones on the phone, how did we do taking care of patient A? Did we do a good job? What feedback would you give our team? And communicating that back to your team. It's pretty eye-opening kind of when you turn the mirror at yourself and go, oh, are we doing a good job? Because we thought we were, but maybe we're not, right?
Yeah. I like that. I mean, having educational meetings, I think most surgeons, I would guess, are, fairly good, I would hope, at educating their assistants who work with them, saying, hey, here's why we do jaw thrust. Here's why we give oxygen, here's why we do the implants in this order, right? Because the more they know, just the more helpful they are, which means things run smoother. There's probably more of a disconnect between the front, desk staff, the communication that's happening there, because as surgeons, we feel the most comfortable in the operating room, right? With a knife in our hands and a drill. Yeah. And less comfortable on a phone and like talking to people. Yeah, I mean, any tips on that one?
Yeah, I mean, I think it's pretty humbling if you walk up front tomorrow at 8:30 and answer the next phone that rings, right? And let your staff watch you do it. Because it's very easy to tell them how you want the phone answered. And then in reality, if you want to do it yourself and you haven't been practicing, it's actually challenging to do it yourself. And I take that from, if you follow Jeff Bezos at all, one of the things he did was he sat down in the customer service at Amazon and he took a call and they were like, oh my gosh, he's perfect. Perfect. And so if you're teaching something, can you do it? Can you do it well? So I love in the tool of things you can use for that, some type of recording on your phone. So there's a lot of ones out there. I don't need to endorse a certain one, but there are lots of AI tools that you can have on your phones that listen to the phone call and transcribe the phone call, and you can review those with your team. So that's something I do regularly with my staff, where we'll sit down for lunch, and I mean, they don't love it when I do it, but like I'll sit down with a printout of like 6 phone calls.
Yeah.
And I'm like, hey, let's read this phone call and tell me what was good and what was bad on the phone call. And I'm not trying to beat anybody up. Like, I'm not going to dock their pay. It's more of like, how would we do it better next time? And the challenge is you have to do it regularly. You can't train one time in February in 2024 and then never do it again. It has to be a constant touch with training.
Yeah. I mean, I found that as well. I feel like if you do it infrequently, it probably comes across more as like you're getting upset with an individual, whereas it's regular, it's just kind of like, this is what we do. We're not picking on a certain person or giving you a hard time in this one instance.
Yeah, but I think at the same time, involving, you said there's kind of this disconnect, which is true in a lot of offices that I see when I'm out lecturing is, sometimes the front desk and the call it the back of the house, the clinical staff, that there's a disconnect there. You need to involve the clinical staff in those conversations, even though they might not be answering the phone for the patient. I know a lot of offices where, phones ring in the back for triage reasons, phones ring in the back for referral reasons. And so sometimes a clinical assistant may be answering that phone. And are they trained to answer the phone the same way that your 5-star front desk is trained to answer the phone? I think that's really important.
That's a great point. Yeah. And yeah, I was just going to say, I could see it going the other way too. Like if you're teaching clinical stuff to your assistants, maybe having people from the back in on that meeting, because that's just more info they could potentially give to a patient. Oh yeah, I kind of know how this procedure goes, and I've seen it, I've heard about it, I've learned about it. Anyways, what were you going to say?
Yeah, I was going to say something right along those lines. Is that I kind of believe in the Swiss Army model of staff, meaning. Okay, fine, you'll have a title because there needs to be one on your, ADP job description for payroll, but everybody in the office should really just be a Swiss Army knife, and should be trained as such, right? So that if I needed you to go answer the phone, clinical assistant, that you have the skill set and the knowledge to do that. Likewise, front desk, if I needed you to jump up and come assist me real quick, you've got some skill set to do that. And I really believe in that. I think that makes a well-rounded practice. And all of these things drive towards that goal of what we're talking about, which is building an implant practice. And implant practice is not a practice where people are coming and spending money in your practice because they had to. It is for the most part a discretionary spend from a patient because they have confidence in you, they believe in you, the experience your office provided. They're not just coming there because they had to.
Yeah, it's a good point. Well, this has been really helpful. I think it's a good rundown of the main pillars, the main kind of focuses we can have as a team to grow our implant practice, to make it just a more well-rounded experience for the patient. So it just goes better for them from start to finish. Yeah. Any other comments about this topic?
Yeah, no, I mean, I think that as I see more and more, like I said, when we had this conversation about doing this topic, is surgeons are looking for ways to grow their implant business, but they're kind of right there in their practice already. It probably comes down to execution. Yeah. And really focusing on some of those small things that we talked about, I think can make a huge difference. And some of it sounds cliche and some of it's, oh, well, I'm already doing that. I think at the end of the day, it's self-reflection and going, am I doing it well? Am I doing it enough? And how can I improve to make those things better? Don't be scared to go ask a referral. Like, if you have to send an implant somewhere, why do you pick me or why do you pick Dr. C down the road? Like what's the differentiator? And then how do I make sure you always pick me?
Great point.
Yeah.
Love it. It's a great topic.
For sure.
I'd love to do another podcast with you where we talk about implant complications, especially when implants are done at, wrong angles, wrong positions with wacky setups. And how do you help a patient, maybe where things are a little bit off, or, it's just, that can be such a challenging experience, helping a patient where things were kind of not done the right way the first time.
Yeah. I mean, I think the question on that one is, how long do you want to talk? Complications, unfortunately, are a big part of my practice. I would say last time I checked, we're over 50% of the cases that I'm treating are revisions at this point.
Wow.
Meaning implants have been placed, implants are being removed, and it's because of the things you're talking about, right? Complications, all of the above.
Yeah.
And so I do think that at the end of the day, we need to do things as a dental community to limit those complications. And we can certainly talk at length about the complications I see and what we should be doing to avoid those complications.
Yeah, that'd be fantastic. Well, Hunter, thank you for taking the time today. If you're good with it, I could put your like email or phone number in our show notes in case people have further questions and they want to reach out to you.
Absolutely. They can reach me. I'm an open book, as you know, as we spoke many times, email, text, call, or they're welcome to, send me a message on Instagram. Either way, I'm happy to answer anybody. So
cool. Thanks for being available. I really appreciate that. All right. Well, I'll let you go, but I'll keep you posted on our next episode.
Awesome. Have a great one. Take care.
You too. Thanks. Bye.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.